It's another, what day of the week? Tuesday. It's Tuesday. I thought it was Monday for a second. Hey, Alyssa. Hello, hello. Hello, everybody. Talking about the deadlift today. We got quite a bit of ground to cover. And if you can, I ask you to bring a broomstick. Sorry, I can hear my neighbor talking. Um, what's up, Mark? Um, yeah, so we're going to be talking about the deadlift. I'm going to give people a couple more minutes to join in here. If you have a broomstick, awesome. If you don't, we're still going to be able to troubleshoot the deadlift, figure out what might be going right, what might be going wrong, how and why you should deadlift, all that good stuff. Yeah, so it's going to be a good time. This is typically a lower body back day. It is going to still be beneficial, even if you don't deadlift. If you're having maybe some back issues, we're going to do a lot of stretching, a lot of mobility stuff that might feel pretty good. Hey, Patty. What's up, Vader? Good to see you in here, man. Yeah, so like I said, grab your broomstick. We're going to get going here in about 2 minutes. You're not going to need this at first. All you're going to need is that mat back there, or carpet, or your bed, or something like that. We're going to start off with some stretching, get you moving, feeling good. Hey, Patty. Yeah, so the deadlift is known more in the powerlifting world. It's included in HIIT workouts. It's finally gaining prominence in mainstream exercising. I think because of the benefits that people see in it. It's great for trunk stability, hip strength, mobility in your legs, thoracic mobility, all that stuff. However, it does hold the potential to be an exercise that can maybe cause some issues if it's not done properly, specifically for the low back. What we can see is as we go down to deadlift, if you're not familiar with it, it's basically picking up a dead weight from the ground, and it sounds kind of exactly like picking up a box from the floor. And as we all know, we don't want to exactly be picking things up with rounded spines or twisting and all that stuff often. Now, it is okay if we're doing that, especially if things are light, but typically when people are working out, we're doing lots of reps, we're fatigued, our spinal control might be a little bit altered, and we might hold a higher potential for injury if we're not doing things well. I often say, when you're going throughout your life, do things the way you're going to do them, but when you're exercising, do it with purpose, and especially do it in a way that's not going to even hold the possibility of injuring you. I'm never going to encourage someone to deadlift with a rounded spine unless they are doing their 1 rep max. At that point, I'm going to kind of let things go because I know that they've trained and they've prepared themselves to handle those loads. But it does hold the potential to cause some injuries if not done well. And that's why I do think that it is important that we go over the mechanics. I've been in, HIIT classes. I've been to, the studios where there's 30 people in there, one instructor, they're doing their best to monitor everybody, but you look around and you see people's deadlift form and it's just tragic to say the least. So we want to make sure that people are out there doing things that are going to be healthy for their spines. The deadlift is great, like I said before, it's great for hip health, great for flexibility of the lower extremities. It's great for back health and also developing strong lats. If you can't do pull-ups, if you can get yourself to be pulling a decent amount of weight, maybe body weight with the bar, you're going to build up your back, a nice, strong, healthy back too. So there's lots of benefit to the deadlift, and there are some pretty simple ways to make it better, to perform it well. I never like instilling fear with the movement, but when you start lifting or doing lots of reps with body weight, twice body weight, 2.5 times body weight, when you're doing these things, hey Frankie, you hold the potential to cause some stress to the tissues of your lumbar spine and your legs. So we just want to make sure that you're doing these safely. So we're going to kind of troubleshoot, maybe point out things that you might see in a deadlift, what you can do about them. But for the most part, it's a simple move. There's always room for tweaking that can get you to gain a little bit more out of your deadlift. But if you're just going through a HIIT class, or you're just doing some circuit work and you're using low percentages of weight, then you should be pretty good with some of these tweaks. But if you need help, troubleshooting your deadlift, if you're looking to powerlift, I have done powerlifting meets. Let's see, I think 2 years in a row I won a couple meets down in Long Beach, so I feel pretty qualified to talk about a deadlift if need be. So reach out if you need some help. But like I said, we are going to be placing the broomstick down and making our way back to the mat, because we're going to be stretching your calves and your hamstrings to start, because those things can limit the amount that you hinge at your hips. The deadlift is a hinging movement. It's not a squatting movement. A squat is a vertical movement. A hinge is a horizontal movement, and we can go over that in a second here after we do these two simple stretches. So I'm going to make my way back, and I'm going to leave this down here. So like I said, first things first, we're going to be going over our calf stretches, because as we let me just make this so you guys can see more of me. There we go. As we go into our deadlift, which is this hinge movement, if we're having tension in the back of the knee here, it's going to kind of limit how far we can get down, and then we might start to round to try to get a bar, a kettlebell, or some dumbbells. So we're going to just start off here. It's a nice little progression of hugging behind your knee, and if you've been following along with me for the past couple months, you know that this is a pretty common one on low back, hip, ankle, knee days. And you're just going to kick straight, and you might feel a big pull on the back of your leg, and that's good. That's what we're going for. We're going to do 10 of these on each side, and as you pull back, you're going to make sure that you're pulling your toes back. You're dorsiflexing your toes, so you're biasing your calf over your hamstring, which would be biased if you point your toes. So we're going to pull your toes back. We're going at a nice smooth pace. Your down leg is extended. If you want, you can squeeze your butt cheek to get a little bit more out of this and stabilize your pelvis. If you get any numbness or tingling down into your feet, that might tell you you have some tension on your sciatic nerve or somewhere in your sciatic nerve tract. I would encourage you to back away from an intense pain if you're getting it with this. Just kind of have a moderate discomfort, okay? You want it to be something you want to do again. I think I got 2 more left. And then we're going to build off this next after we do this next side. And we're going to start using our trunk musculature as well as mobilizing the backs of our hips and our hamstrings, so we can maybe get some great range of motion for our deadlift, so we can get down there and grab the bar or grab that kettlebell that's way down there. Deadlifting is a great way, especially in the physical therapy world, to get people to be a little less scared of picking things up. I hear it all the time. I can't pick up my kids, or I can't pick things up at work. And the deadlift is great because you can lift off the ground, you can make modifications, and you can make it so people can see that it's safe to lift, they're strong, they're resilient, they can recover. You got 3 more to go. So we're just stretching out your calves and your hamstrings a little bit. And I got 1 more left. All right. So I'm going to give you 2 variations of this next exercise. I'll show you the easier one first, and that's actually holding behind your leg. So you keep that leg straight. It's kind of the ending position that we had with the last exercise. Then you're lifting up and controlling the way down. And we're actually going to be stretching the hamstring of the up leg. And so you can go here for 10. Or I'll give you the option to really emphasize your trunk a little bit more, and you just hold that leg up there with no arms. But if you start really bending your knee, I want you to use that support so you can keep your legs nice and straight. We're going to go for 10 on each side. So you might feel your quads shaking, your hip flexors are working, which is awesome. Hip flexors are working on the leg that goes up and down. And in a couple minutes here, we're going to stretch your hip flexors out, because the top position of a deadlift is another area where people can kind of go wrong with their deadlift and put undue strain on their back. So we're going down here. I'm actually going to use my hands on this one, because I know my right side's a little tighter. It'd be a big struggle for me. 2, 3. But if you want no hands for your 10 reps, you're always controlling that way down with the moving leg. 6, 7. Oh, we gotta lock that leg out. So even I get a little sloppy sometimes. Just gotta always be checking myself. 2 more. What do we got on this? Pigeon. 10. Great. Okay, so let's go over the hinge versus the squat really quick. So with the squat, if you watch my body, I kind of fold up. Yeah, I rounded my back a little bit there, but I don't have weight, so I'm okay. My knees and my hips bend pretty much the same amount, okay? And that is kind of what distinguishes a squat from a hinge. So I'm going up and I'm going down, but if I'm doing a deadlift, my hips are going back and my hips are bending more than my knees. And so if I had a barbell here or a kettlebell, I'd be grabbing it. And so I'm coming up and going down, where my hips are going back and they're coming forwards. So what we need is we need good extensibility in the tissue in the back of our leg. So we need our butt muscles to be able to stretch out. We need our hamstrings to be able to stretch out. And same thing with the calf. And so that's why we're focusing on the back of the leg first. It's a great place to start to allow you to get down to the bar, okay? So we've done a calf stretch, we've done some hamstring stuff, and now we're gonna be stretching our glutes out to help you get into a better position. Because like I said before, if you're really tight or limited in the back of your leg, this is probably gonna be where you go, okay? You can also modify to bring that weight up while you're learning or while you're working on your mobility. You can put the kettlebell on a box, you can use some blocks for the barbell, anything that keeps you in a good position while you're doing your lift. We're gonna go into our pigeon though. So you got your leg out in front of you. It's mostly perpendicular to your body. Everybody's different. The mobility and the shape of our hips are different for everybody. Even side to side, you might see differences in what you're doing. And with your pigeon, especially if you're having any issues with your low back, or if you're gonna be getting ready to deadlift, I want you to keep your chest up because we want to emphasize a little bit of a more natural lordosis in your low back or extension in your low back while getting most of that stretch right here in the hip. We're going to be going for another about 30 seconds or so, and then we're going to switch sides. Then we're going to stretch our hip flexors because we just used them a minute ago. We told them when to turn off and on, unlike what we do with most of our day, where we're just sitting, allowing them to shorten because of their elastic qualities. And then we go to stand, and maybe there's a little bit of tension on our spine, or maybe because of adaptive shortening, we can't extend our hip really well at the top of the deadlift, and we're going to go over that before we talk about your hip flexor stretch here in a second. All right, so we're going to switch. All right, so chest is up still, stretching out, leaning into the side of the hip, stretching out the glute. You might feel a little bit of hamstring tightness depending on your flexibility and mobility. You're just breathing into it. If you need to use a yoga block underneath your stretching hip, please support yourself. Make these stretches work for you. Everybody's kind of got their sweet spot with every stretch, but you want it to be something you want to do again, or you're going to avoid doing it, and then you're not going to be able to change the way you move, or the quality of your movement, or the amount you move, all that stuff. And the goal here is just to make sure that you're a little bit more resilient. You increase your capacity for work versus having to take things away. So just going to be here for another 20 or 30 seconds, and then we'll go over what I mean regarding the top of your deadlift being problematic, where you might need to do a little bit more hip flexor stretching, maybe get up throughout your day a little bit more, especially if you're adding more deadlifts into your program, or if you know that your workouts include lots of deadlifting or lots of even overhead pressing that might require extension or a lockout of your hips. Okay. And what I mean by that is that if we're sitting all day, these muscles in the front of our hips will actually shorten over time, and it doesn't take very long. It only takes about 20 minutes for that process to start to happen, where they stay short and the muscles and the tendons start to actually shrink up, and then you go to stand and they don't want to extend very much. And so if your hip flexors have decreased length and they can't extend to their full abilities, what's going to happen is you're going to get to the top of your deadlift, your hips aren't going to be able to extend, but you're going to still go up, and you end up kind of popping your butt out, okay? And we're not torquing. We want to be able to get that extension in your hip, that full lockout. So if you notice, like, you get to the top, you're really arching your back, chances are you're going to be compressing the joints in your spine, and gradually over time, you're increasing the likelihood that your facet joints, or the joints in your spine, actually start to bother you. And even the muscles in your low back are going to try really hard against that resistance of your hip flexors, and they might start to get irritated too, sending pain, tightness, discomfort, whatever it is, through your low back, even into your legs. So that's why a hip flexor stretch, especially after we've used our hip flexors, is important. Really quick, I want to touch, I said overhead pressing. If you think about overhead pressing, doing a military press, you want to be in that same position as you're pressing overhead. It's kind of this shape that we get into. The top of your squat, regardless of where you are, same position. The top of your deadlift, your overhead press, and your pull-up, all are the same position. So we're basically trying to get you to be able to do all of your big lifts well with good hip extension. That's why it's so important, except we do this one activity almost all day, every day, that is like the anti-performance enhancing activity, and that's sitting. Sitting in itself isn't necessarily bad for you. It's just doing nothing for so long is really bad and leaves you less physically prepared to do all of these things. That's why I love hip flexor stretching, because it's kind of like the anti-sitting. So we're going to go into this half kneeling position to do this. You're going to lean forward and you're going to tuck your pelvis underneath. And this is to get you ready to come up here and get good extension in your hip. If you're sitting here with an anterior pelvic tilt and you try to stretch, you're not going to get anything, okay, because you've shortened your hip flexors in the front. We want to posterior pelvic tilt, come up, and if you need a little bit more stretch, I want your torso in your hip to go forward, okay? I don't want your back to go back. That's just causing more compression. That's kind of like feeding into the problem that we're trying to fix here. So you tuck, you're up, and if you say, Mike, this isn't that much, but I want to feel a stretch, go ahead and reach back, grab your foot or your ankle, but stay tall through your hip and through your torso. And we're going to be here for 60 seconds, just hanging out, working on our hip extension, the top position of your squat, the top position of your deadlift, and it's the top and the bottom of your overhead press and your pull-up. So it is important to do. I can't think of an athlete I've worked with or a patient I've worked with who I don't have do some form of this. Maybe some of the dancers I've worked with in my past probably don't need this, and they need tons and tons and tons of strength and stability work. I don't focus too much on their stretching. And we'll switch it around. And we'll get that other side. So you're down, you're putting your back toes down. Might as well get that big toe mobility. Tuck your pelvis and come on up. And I'm feeling a pretty good stretch, but I think I can actually get back here besides my knee being on a pebble. Okay. And then we're going to start using this extension that we're working on getting very easily, very gently with some bridging, which is just another form of a hip hinge, some single leg bridging, which just biases one side versus the other, works a little bit on rotation of your trunk, making your abs and obliques work a little bit harder. And then we're going to start using the stick, okay? We're going to start basically giving an external cue to your spine of what shape it should be in. And now it's not going to be straight like the stick. We're still going to have those natural curvatures. It's just going to help us maintain them. And I hope this is over soon, because this rock that my knee is on is killing me. All right. Okay, so bridging. If you think about the move that a deadlift is, it's just here to here. And if I'm laying on my back and I'm lifting my hips, I'm just going through that same exact hip hinged movement. And so we're going to be doing 20 bridges, just regular old-fashioned bridges. If you want to play around with a variation that you know of, be my guest. The one thing I don't want you to do is posterior pelvic tilt and round up, okay? I actually don't want that to be the movement that you start to put into your nervous system right now, into your motor control patterning right now. Because if you were to do that with weight when you're deadlifting, you're flexing your lumbar spine under load, which has been shown to be a risk factor for injury. We're trying to avoid that. That's the whole reason we're here. So I'm going to have my feet be shoulder width apart. You can actually go wider, or you can go more narrow. I want this to kind of be your bridge. This one's for you. Ooh. I don't know what my dog's barking at. But we're going to be tight through your trunk, like someone's going to drop a bowling ball. We're not rounding or flattening our spine. And you're pushing up. And I want a straight line from your knee to your shoulder. And then we're coming down. We're coming up, and I'm squeezing my butt cheeks. Now, if you're cramping in your hamstrings while doing this, I want you to take your hands
You're going to put them right on your butt cheeks, and as you squeeze up, I want you to feel them tighten together. I'll often tell people at the top, I want it to be like there's a $100 bill between your cheeks, and you can't let anybody take it from you. So you're just squeezing that dollar bill and letting it go down. If you don't need it, if you feel good and you're not getting the hamstring cramp, don't worry about it. You've got, I think, 11 more. So I'm doing so many reps because I want to ingrain this hip hinge movement into your motor patterning. Hey, Frankie. I'm about to get a lot of kisses. Oh, yes, thank you. You gonna be my pillow? And you guys just keep going. I'll catch up with you. Thank you. Oh, you're breathing into the microphone. How nice of you. And I'm gonna go for 3 more. Hi, bud. Hi. Yes, thank you. 2 and 3. All right. So the reason I'm gonna have a what? The microphone? Oh, I lost it. So the reason I'm going to have us do some single leg bridging is because we might find that with both legs, when we're bridging, we might be able to compensate with one side versus the other. And now going into a single leg bridge, you might start to be able to pick apart if one side is doing a little bit more work than the other. And this might just give you a better idea as to whether you need to do some single leg deadlifting on that side to catch it up, or if you need to do some single leg bridging to really just wake up your glute so you can provide good hip extension at the top of your deadlift. I'm going to try my best to do this with a bulldog in my lap. Hey, hi. Okay. So what we're going to do is you're going to hug your knee into your chest. I'll go this way. Excuse me, Frankie. All right. So I'm bringing my knee up into my chest. Once again, I'm bracing my trunk. I'm not rounding my back. Okay. I'm not flattening my back. I'm going to push through my down heel. I'm going to come up, and I want to feel my glute work and then come down. I'm trying to keep my knee as close to my chest as possible. 2, 3, and we're going for 8 to 10 on each side. 4, 5. It's always nice when we can get a cameo from Frankie. It's like she's full of love. Just wants to give kisses. 6, 2 more. 7, and 1 more, and 8. Okay, and we're going to switch. So just hugging that knee in, driving through the down foot, down heel. You might even want to pick the toes up on the working leg because that ensures that you're driving through that heel, putting a little bit more neural drive into the posterior or back structures of your leg, being your glute, a little bit of your hamstring, and some of your calf. But we really want this to be the glute. And once again, if you don't feel it in your glute, you feel it most in your hamstring, put your hand right on that butt cheek and make it squeeze. It's a tactile cue. You're touching that muscle, making a better connection in your mind with that area of your body so you can produce a better contraction. We're going to go 1 more. All right. Okay. We're going to keep going on the single leg train, but we're going to need our broomstick. Now, if you don't have this, it's still possible that we can do it. You're just not going to have as much feedback from the dowel or the broomstick or whatever you're using. But what we're going to do, we're going to set this up to do, let's see, 1, 2, looks like we got 3 exercises. With this same setup, we'll be adjusting in between. But what you're going to do is you're going to take the stick, you're going to put it on the back of your head, you're going to touch it to your spine between your shoulder blades, and then you're going to touch it right at the bottom of your spine or between your butt cheeks. And as I hinge my hips, as I bring my hips back, if I'm really stiff in my thoracic spine, I'm probably going to lift my head forward, and the stick is going to lose that connection. You'll see that there. That tells me that I probably need to work on my thoracic mobility. Or if I go to hinge and it comes off my low back, I'm probably rounding my lumbar spine versus being able to express good length in my hamstrings and my glutes, meaning that I probably want to stretch those out or work on the mobility or lengthening of those tissues. So this stick can give us a sense of what do we need to work on before we go and deadlift. Is it thoracic mobility or is it posterior structures? Is it trunk stability, which would be good for both of those, okay? So if the stick is coming off on either end, chances are you need to work a little bit on your trunk stability. Those bridges would be good. Some planking and other variations of trunk stability stuff would be great. Now, it doesn't matter which hand is up and which hand is down, but you have one hand behind the nape of your neck and one hand in the little lordosis, or the extension of your lumbar spine. It's touching all those other places. From here, you're going to push your hips back and you're going to maintain those points of connection. And you're going to go as far as you can while maintaining those points of connection. You're going to shift your weight mostly onto one leg, and then you're going to tap back with the other foot. And then I just want you to shift your weight to the other side and tap back. And so we're challenging your trunk stability while maintaining that hinge, which is basically our setup position in our deadlift. And then we're going to start adding some movement to this next with some stick hinges. So right now we're just maintaining the hinge. We're not coming up and down. We're just going side to side. And you're going to make 5 on each side, maintaining all 3 points of contact as good as you can. I got one left. Do one for good measure. All right. And so you now know what you need to work on as far as maintaining your spinal position in your deadlift, okay? Because both of those, we'll say faulty positions can lead to undue stress on your neck, on your spine, on your shoulders, on your low back as you're deadlifting, right? So if you have a really rigid thoracic spine, you're not going to be able to get good extension or retraction of your shoulder blades and engagement of your lats, which are huge for good deadlift form, okay? Your lats are what are going to pull your shoulders out of your ears and keep your spine in a normal, let's say neutral position. So we're going to continue that same position of 3 points of contact, back of the head, between the shoulder blades and the butt cheeks, or between the butt cheeks. And we're just going to start hinging, okay? So we're going to actually keep both feet down. We're going to make 10 hinges where you're going to push your butt back as far as you can while maintaining those 3 points of contact, and then up. And when you come up, I want it to be as if you had your body weight in your hands, okay? As if you have to squeeze your butt cheeks so hard together, because I want you to start getting used to producing lots of force with your glutes. We're going to do 10 while maintaining that trunk stability. So if I produce a lot of force with my glutes, but I have a really loose trunk, I'm going to lose that connection. And all of a sudden, I've rounded my low back, tilted my upper body forward, and I'm putting a lot of stress in my spine. Up, there we go. And so I'm going to do 6 more. We're doing 10 total. And this is very similar to kettlebell swings, single leg deadlifts, and deadlifts. It's also part of cleans and snatches in the kettlebell world. I think I got 2 left, maybe 3. 2. You need to maintain those 3 points of contact. If you're like, oh man, I'm rounding my low back, I'm just gonna overarch my spine, well, all of a sudden you've lost that contact between your shoulder blades, and that's gonna cause a whole other problem with compressing the joints in your spine. So it's this fine balance of being not too flexed and not too extended, because both of those are going to cause lots of stress in your back as you're deadlifting. Let's see here, we've gone stick hinges. Okay, so we're going to do something called a clean grip hack deadlift. Ugh. There's something called a hack squat. We did it a long time ago. It's where you're holding the weight behind your back, and a clean grip is nice and wide. And so I want you to hold your broomstick so wide behind your back that it sits right below your butt cheeks and it's on your legs, okay? So if I hold this really narrow, it's dropped down a little bit too low. If I hold it really wide, all of a sudden it goes above my butt cheeks. So basically put it below your butt cheeks and find a grip that's wide enough where you can maintain it there. I'm actually gonna pull my shoulder blades back and I'm gonna hinge again. And so this is teaching us to keep your shoulders back and to engage your lats as you move your hips. Okay, so we're avoiding being really passive in our upper bodies as we do deadlifts, okay, because it is a whole body exercise. Like I said at the very start of this, if you can't do a pull-up, or if you're looking to get better at your pull-ups, throwing in heavy deadlifting into your programming or into your exercising is actually going to help you a lot because of how much lat engagement is included. So stick goes below your butt cheeks. Grip is so wide that it just stays there, right? So we're not down here and we're not up here. And you're just going to do 10 total of pushing back into that stick, keeping your shoulder blades back, and hinging. Keeping that stick below your butt cheeks. 4, 5. And you'll see I'm not staring off at anything in the distance. My neck is part of my spine. And so I'm keeping it nice and stable. I'm not going here and here, okay? Because it is possible if you're holding a lot of weight and you're moving your head around like that, that you might start to feel a lot of upper trap discomfort, a lot of neck discomfort as you start picking up some weights. There you go, 4 more. 1, 2, 3, and 4. Good. So I hope with that, you were able to maintain the positioning that we kept with the stick hinges, okay? Which we're gonna go back to now because we're gonna start taking away a leg again. So we're working a little bit more on incorporating hip stability and building off the trunk stability that we've been working on with the stick hinges. So we're gonna start taking a leg away to make this a difficult exercise that starts to hit save on the motor programming that we've been working on. So you're going to take your stick. It's going to be same 3-point position. I prefer this one for now. Same 3-point position between the butt cheeks, between the shoulder blades, back of the head. You're going to get into your hinged position just like we did with the very first weight shifting, okay, with the side-to-side weight shift. You're going to take that one leg away, so I'm really loaded up on my left side, and then I'm coming up. And then I'm going through that hinge. Now I'm taking my foot off the ground. I'm still maintaining my trunk position. And I'm just going to do 8 on each side. 3. And so by maintaining all of that trunk stability, now I can do all of the work with my hip. There's a huge focus now on my single leg deadlift, making my glute work. 3 more. And then we're switching sides. And we just have one last exercise. In this next exercise, and I'm going over 3, great. And now we're going to the other side for 8, maintaining all 3 points of contact. And you might see that if you can't maintain the stability on one hip, you might start to do some funky things with your spine, and that might tell you what the issue is with your deadlift, not just your single leg deadlift, but with both. 1, 2, 3, 4, 5, 6, 2 more, 7, and 8. Okay, so Mike, what do I do if I can't maintain those 3 points of contact? Well, 1, I would work on the mobility and flexibility of the structures, the back of your leg and your thoracic spine. What? Oh. 1 second. You guys hear me now? Hope so. So maybe you're struggling to maintain your spine position with the stick back here. Woo. So maybe you're struggling to keep those 3 points of contact. It's not in the cards right now, but you still want to work on your single leg hinging and your hinging. And so there are options that we have to do this. And what you can do is if you have your stick or even a foam roller, I actually like a foam roller a little bit better for this one, but we have our sticks here, I'm here, you're here, awesome. What you can do is you can put that stick right on the top of your toes, top of your foot. You're gonna push down. This is going to make sure that you keep that back leg straight. And now, this is not a balance exercise. So I'm not too concerned about you maintaining your balance with your hip at this point. We're trying to pattern the hinge. We're trying to get that hip movement and spinal movement to be appropriate so you can load it up with some weight. You can hold on to your wall. You're going to put that stick on the top of your foot. You're going to push back. And you'll see that makes sure that that leg is straight as it goes back. And like I said, you can do this with a foam roller. It's actually a little bit easier if you have a little more surface area in the back. Then you come up. Push back. You want your back leg to be an extension of your spine. You got 5 more to go. And then we're going to switch. We're going to do 8 on this side, and then we're all done. The top of the foot with the stick or the foam roller. Pushing back. Use the wall. You don't need to use the wall. And 8. Okay. So, I'm going to come over and see what comments, questions people have. As always, you can reach me via my email address, my direct messages, all that stuff. See what people had to say here. All right, well, doesn't look like there were any questions, which is great, but I know that people are going to go and they're going to try to do these things on their own, and there's going to be a couple questions coming my way. So the deadlift is an amazing exercise for just overall health, fitness, strength, mobility, flexibility, all that stuff, but it holds the potential to have some things go wrong, and I hope that we were able to address those today and make it so you feel a little bit more comfortable. Maybe you're out, in your garage doing, following with a at-home workout. Maybe you're going to your group fitness classes, your HIIT workouts, all that stuff, and the instructors don't have enough time to correct you. Well, empower yourself, learn how to do these movements on your own so you can actually, reduce your risk of injury or stress going through your back and feel better. And a deadlift, actually, before it was called a deadlift, when people first started doing it, it had a name that was actually the health lift. That's right, the health lift, because it is so good for you. It was thought of to provide you with longevity and overall health, and I actually agree with that. From grip strength to flexibility, mobility, strength, all that stuff. You do enough of them too in a row, and it's going to also provide cardiovascular strength as well. So the deadlift is near and dear to my heart. There's so many variations, so many hip hinging movements. When I'm in a pinch and I have 15 minutes, I'm going to throw some kettlebell swings in there, which fall within the same family of the deadlift. It's the hip hinge. So grateful, Eileen. It's been my pleasure. So like I said, if you have any questions about this or anything else, please shoot me a message in my direct messages, or you can reach me at kineticpotentialpt@gmail.com. Easiest way to get in touch with me. I love helping you guys out, so I really appreciate you guys spending your time with me and figuring out how we can make you move better and feel better. So let's see, today's Tuesday. I will be back here on Friday. We're going to talk a little bit about winged scapula. What is it? Is it bad? Is it good? Does it matter? What can we do for it? So we're going to be making your necks and shoulders feeling really good. So spread the word if you know anybody who needs that, or if they need a little deadlift tutorial, send them my way. So thanks again, and please always get your sleep, which I'm not doing much of right now, but I'm trying to sneak it in there. Drink your water, eat your vegetables, and get your movement in, and I will see you guys on Friday. Thanks for tuning in.